We are right in the middle of Breast Cancer Awareness Month, and a key step really is protecting your own health, and that means early detection.
It's easy to put things off, but you should never wait too long for your mammogram. Caitlin Francis spoke with the experts at Jefferson Radiology about the simple steps that can save your life.
What should be a simple 15-minute test turned into a years-long wait for many women.
No, you really should not be putting your mammogram off. It's absolutely true. The data is very strong that early detection, the sooner we find the cancer and the smaller it is, the better the patient's going to do. So there was data that came out a couple years ago that showed if the cancer is, we use the metric system, but I'll say less than ½ an inch in size, which we could definitely see on a mammogram or even an ultrasound. If that's the case, your chance of surviving that cancer at 5 years after your diagnosis is more than 95%. So it's critical. I mean, it's basically curable the smaller we can find it.
But for many women, life-saving mammograms got put off because of the pandemic. Dr. Diana James says if you're one of those women, it's time to come back in.
I would encourage anybody to come in and get a screening mammogram, and I think it gets super scary once you've put it off for the first year, maybe the second year, and it could be the third year at this point. Just get to do it. Most of the time it's still fine, and then you'll have that knowledge and you'll feel so much better if you just get that exam, get that good news that everything's fine, and you can go on with doing probably the other things on your to-do list as far as your health.
Early detection is key. Self-checks at home, keeping a regular schedule, and of course, checking in with your primary care physician are all great ways to stay on top of your health. Jefferson Radiology is using technology that can also help.
3D mammography has, I don't want to say game changer, but I will. I mean, it's definitely changed what we do, especially for women with dense breast tissue. So at least 40% of women in general have dense breast tissue. So it's about half of women. It's extremely common. And the 3D mammogram has enabled us to kind of really look at the layers of the breast. So we can see inside. So if there's a cancer hiding inside there, or there's the secondary signs of a cancer inside the layers of tissue, we can now find that.
They also started using artificial intelligence software as an electronic set of eyes to go through the hundreds of images from the 3D mammography. You can see Dr. James going through some of that here. The AI will detect if there's a chance for cancer, and the doctors will confirm by looking through the slabs of images.
And unfortunately, you can see where that circle is. We see this white area that's very dense, and unfortunately, that's what breast cancer looks like on a mammogram.
The 3D images allows doctors to get results back quicker and also be much more precise. Take a look at this rose. You can see the difference in just how clear the image is from 2D to 3D.
One of the signs of breast cancer on the mammogram is something called microcalcifications. And a definition of a microcalcification is something of the size of 0.5 millimeters. Again, the metric system. But you can think of it like fine grains of sand. So it's not something you're going to be able to feel. You can't feel little tiny granules of sand in your breast. But it's something we can actually see on your mammogram. And it could be the earliest sign of DCIS, which is ductal carcinoma in situ, which is the earliest form of breast cancer we can diagnose.
If you're genetically predisposed, doctors will invite you to join the monitoring system early, and you'll be monitored more frequently. But typically, all women 40 and older should be getting their annual mammogram. Basically, you don't want to skip it.
There are 10 Jefferson Radiology locations all across Connecticut, so that's convenient. For more information or to schedule an appointment, you can visit jeffersonradiology.com.
You can also follow them on Facebook at Jefferson Radiology.